We're ready. Let's do some. We're ready. It's dynamic quizzing. Okay, gonna go ahead and mute that so that whatever. Okay. Oh yeah, I should probably turn that in. Okay, let's hope this works. That way I can listen to this later on. Okay, custom quiz, quick study. Gotta clear all that. All the fundamentals. Watch them do 20 because I'm pretty exhausted right now. Start the quiz. Alright, first one, the nurse is collecting data to determine a client's cardiac function via palpitation. At which of the following sites should the nurse palpate for thrills in the mitral area? Make a selection image below and choose only the hotspot that corresponds to the answer. Mitral valve. All people enjoy time. Magazine. Okay, mitral valve, which is located in the apex of the heart, should be below the nipple line. And I was right. Okay, next one. A nurse is caring for a client who has methicillin-resistant staphylococcus, whatever, MRSA. Which of the following precautions should the nurse implement? A. Place the client in a semi-private room. B. Wear a mask when providing care. C. Apply a gown when in the client's room. Or D. Dispose of all bed linens used by the client. Okay, so Staphylococcus MRSA is a contact precaution, so you should apply a gown when entering the client's room. Okay, a nurse in a provider's office is collecting data from a 3-year-old client during a routine physical examination. Which of the following findings should the nurse report to the provider? A. Can skip. B. Can identify 4 colors. C. Cannot print their name. D. Cannot walk up stairs independently. Okay, the answer is D. Cannot walk upstairs independently. By the age of 3 years, toddlers should be able to walk up steps without help, use blocks to build a bridge, balance on one foot, jump, copy a circle, and speak in sentences of 3 or 4 words. The nurse should report the client's inability to climb steps without assistance to the provider. Okay, next one. A new resident provider asks the nurse for an access code to review a client's online record. The resident is not scheduled to attend the facility's computer orientation class until next week. Which of the following actions should the nurse take? A. Explain that sharing access code is against policy and refer the resident to the supervisor. B. Access the client's online data and monitor the resident during usage. C. Access the online client data system and allow the resident to locate the client's data. Or D. Ask the client to give permission for the resident to access the medical records. Okay, the answer is A. Staff should never share access codes and passwords or allow people who do not have their own access code to use the system. Sharing codes is a breach of federal guidelines for data security and client confidentiality. Okay, number 5. A nurse is reinforcing teaching with a client about the use of a straight-legged cane. Which of the following client actions indicates an understanding of the teaching? A. The client holds the cane on the unaffected side. B. The client walks by stepping with the unaffected leg before the affected leg. C. The client holds the cane directly next to the foot. D. The client holds the cane with straight elbows. Okay, correct answer is A. The client holds the cane on the unaffected side. The nurse should instruct the client to hold the cane on the unaffected side to provide a wide base of support and stability. Okay, next one. A nurse is collecting data from a client who is experiencing an obstruction of the flow of the vitreous humor in the eye. The nurse should identify that this manifestation is consistent with which of the following eye disorder. Okay, A. Retinopathy, B. Glaucoma, C. Cataracts, or D. Macular degeneration. Answer is B. Glaucoma. An obstruction of the flow of the vitreous humor of the eye is a manifestation of glaucoma. This obstruction leads to increased intraocular pressure, resulting in damage to the eye. Okay. A nurse is preparing a liquid medication from a multi-dose bottle prior to administering it to a client. Which of the following actions should a nurse take? A. Make sure the label on the bottle faces downward when pouring the medication. B. Place the medication cup on a paper towel. C. Check that the mark on the dosage matches the fluid level at the top of the meniscus. D. Place the cap of the bottle upside down on a clean surface. Okay, the answer is D. Place the cap of the bottle upside down on a clean surface. The nurse should place the cap on the bottle upside down on a clean surface to keep the cap clean and avoid contaminating the inside of the cap. Okay. Next one. A nurse is assisting with the admission of a client who has tuberculosis. In addition to standard precautions, which of the following transmission-based precautions be added to the client's plan of care? A. Protective. B. Airborne. C. Droplet. D. Contact. Okay, this should be airborne. Tuberculosis requires airborne precautions, which are protocols that prevent the spread of infections via small droplets such as measles, varicella, and tuberculosis. Okay, a nurse is calculating a client's intake for a 12-hour shift. The client had dextrose 5% in 0.45% sodium chloride infusing at 125 milliliters per hour. Gentamicin, what is this? 150 milligrams in 100 milliliters at okay, let me try that again. Okay, gentamicin 150 milligrams in 100 milliliters at 1400. Famotidine 20 milligrams in 50 milliliters at that 10,000 and 1600. 250 milliliters of blood over 2 hours, and a nasogastric flush of 30 milliliters every 2 hours. What is the total intake in milliliters that the nurse should document for this client for this 12-hour period? Okay, the answer is 2130. It's kind of hard to. Alright, whatever. Okay, next one. A nurse is preparing to measure a client's blood pressure with a sphygmomanometer and a stethoscope. Which of the following actions should the nurse take? A. Wrap the cuff loosely around the client's arm. B. Use a cuff with a bladder that encircles 60% of the client's arm. C. Place the cuff so its lower edge is 1.3 centimeters, 0.5 inches, above the antecubital space. Or D. Have the client place both feet flat on the floor. The answer is D. Have the client place both feet flat on the floor because crossing the legs at the knee area can raise both systolic and diastolic blood pressures. They're not it. Okay. A nurse is assisting a client who has dysphagia at mealtime. Which of the following actions should the nurse take? A. Assist the clients into a semi-sitting position. B. Have the client lean slightly backwards. C. Advise the client to tuck his chin downward. D. Instruct the client to tilt his head slightly backward. Okay, correct answer. C. To help the client swallow safely, the nurse should have the client sit upright, lean slightly forward, tilt his head forward, and tuck his chin. This position helps move the food downward without lodging in the throat, avoiding potential aspiration. Okay, number 12. Nurse is caring for a client who requires wrist restraints. Which of the following actions should the nurse take? A. Tie a secure knot with the restraint straps. B. Attach the restraint straps to the side rails. C. Make sure three fingers fit beneath the restraints. D. Remove the restraints at least every 2 hours. Answer is D. The nurse should remove the restraints at least every 2 hours to reposition the client, provide fluids and nutrients, assist with range of motion exercises, and evaluate the client's overall well being. Okay, next one. A nurse is obtaining the blood pressure in a client's lower extremity. Which of the following actions should the nurse take? A. Auscultate for the blood pressure at the dorsalis pedis artery. B. Measure the blood pressure with the client sitting on the side of the bed. C. Place the cuffs 7.6 centimeters or 3 inches above the popliteal artery. Or D. Place the bladder of the cuff over the posterior aspect of the thigh. Answer. Place the bladder on the cuff of the posterior aspect of the thigh. This is the correct position for the nurse to place the bladder of the cuff when measuring a lower extremity blood pressure. Okay, next one. A nurse is caring for a client who just received a diagnosis of cancer. The client states, I just don't know what I'm going to do now. Which of the following responses should a nurse make? A. In time, you know the right thing to do. B. I'm sorry, would you like me to call someone for you? C. There are multiple treatment options for you to consider. Or D. Can you explain the concerns you're having right now? Okay, answer D. Explain the concerns. This response uses the therapeutic communication technique of asking relevant questions. By using an open ended question to ask the client to explain any present concerns, the nurse is encouraging the client to respond and provide additional information. Okay, number 15. A nurse is helping a client change his hospital gown. The client has an IV infusion on an infusion pump. Which of the following actions should the nurse take first? A. Remove the sleeve of the gown from the arm without the IV line. B. Slow the infusion using the roller clamp. C. Disconnect the IV line from the pump. D. Bring the IV solution and tubing from the outside to the end of the sleeve of the gown. Correct answer A. Remove the sleeve of the gown from the arm without the IV line. According to evidence-based practice, the nurse should first remove the gown from the client's arm without the IV line. Beginning the process in this way will enable the nurse to move the gown fully off the client and then stop the system to remove the gown from the line, resulting in minimal interruption of the IV flow. Okay, 5 more. Okay, let's see, what's this say? A nurse is reinforcing teaching with a client who has a new colostomy. Which of the following statements should the nurse identify as an indication that the client understands the instructions? A. I will empty the pouch when it's about 75% full. B. I will replace the pouch every 10 days or so. C. I will make the opening in the skin barrier about a half an inch bigger than my stomach. D. I will make sure to replace my pouch around 4 hours after I eat. Answer is D. It is best for the client to replace the pouch at a time when the bowel is least active, either after arising in the morning or at least 2 to 4 hours after a meal. Otherwise, the client risks releasing stool while there is no pouch in place. Okay. 17. A nurse is reviewing a client's laboratory report. The client's ABG levels are pH 7.5, PaCO2 32 millimeters of mercury, and HCO3 24 milliequivalent per liter. The nurse should determine that the client has which of the following acid base imbalances. Answer is A. Respiratory alkalosis, B. Metabolic acidosis, C. Respiratory acidosis, or D. Metabolic alkalosis. Answer is A. Respiratory alkalosis. ABGs are drawn to determine the acid-base balance in the arterial blood. This client's pH is elevated above the expected range of 7.35 to 7.45, indicating alkalosis. The client's PaCO2 is below the expected range of 35 to 45, which indicates a respiratory origin. The nurse should conclude that the client's elevated pH and decreased PaCO2 indicate respiratory alkalosis. Okay, fun fact, ABG doesn't actually mean Asian baby girl. It actually means arterial blood gases. Okay, next question. All right, what's this? A nurse is caring for an older adult client who is violent and attempting to disconnect her IV lines. The provider prescribes soft wrist restraints. Which of the following actions should the nurse take while the client is in restraints? A. Tie the restraints to the side rails. B. Perform range of motion exercises to the wrist every 3 hours. C. Remove the restraints individually. Or D. Obtain a PRN prescription for the restraints. Okay, answer C. Remove the restraints individually. The nurse should remove each restraint individually for a client who is violent or non-compliant. Okay, two more. All right. A nurse is caring for a client who has the head of his bed elevated to a 45-degree angle with his knees slightly flexed. Which of the following positions should the nurse document for the client? A. Sims, B. Prone, C. Supine, or D. Fowlers? Answer is D. Fowlers. This describes a Fowler's position. Although various definitions exist for Fowler's position, generally a low Fowler's position is 30 degrees of elevation, semi-Fowler's position is 45 to 60 degrees, and high Fowler's is 60 degrees to 90 degrees of elevation. Okay, last one. A nurse. Oh, what is this? Okay. A nurse is prepared to administer eye drops to a client following surgery. Which of the following actions should the nurse take when instilling eye drops? A. Drop the eye medication into the lower conjunctival sac. B. Apply gentle pressure in the outer opening of the eye for 2 minutes. C. Hold the eyedropper 0.5 centimeters or 0.2 inches from the cornea. Or D. Insert the client to close eyes tightly after administration. Answer is A. Drop the eye medication into lower conjunctival sac. The nurse should drop the eye medication in the lower conjunctival sac to avoid placing drops on the cornea and causing damage. All right, should be enough for today.